If you've ever felt a strange flutter in your chest after taking vitamin C, you're not alone, and it's reasonable to wonder what's happening. It can be unsettling when your body does something unexpected, especially when you're trying to support your health. The short answer is that while it's uncommon, some people may experience heart palpitations from too much vitamin C, particularly when taking very high or megadose amounts. When you feel an unexpected racing, pounding, or skipping sensation in your chest, it's natural to be concerned. Heart palpitations often feel like a fluttering, pounding, or skipped beat. While they're frequently harmless and associated with things like stress or caffeine, they can sometimes be a sign that your body is reacting to something, including a high dose of a supplement. Understanding the connection between high-dose vitamin C and heart rhythm can help explain why your body might react this way. There's an important difference between a beneficial dose that supports health and an excessive amount that may cause unwanted side effects. In the sections ahead, we'll explore the difference between normal and megadoses of vitamin C, how your body may signal that you've had too much, and the science behind how high vitamin C levels could potentially affect your heart. Vitamin C is well known for its health benefits, and many people use it regularly. But like many things in health, more isn't always better. The connection between vitamin C and your heart rhythm. How could a vitamin that's generally considered healthy potentially affect your heartbeat? Under normal circumstances, vitamin C acts as a powerful antioxidant, helping protect cells from damage. You can think of it as a protective shield that helps defend your body's tissues from everyday wear and tear. However, at extremely high doses, vitamin C may behave differently. In some situations, it can act as a pro-oxidant, creating cellular stress rather than reducing it. Instead of helping maintain balance, excessive amounts may contribute to biological stress that affects sensitive systems within the body. This possibility often comes up when people begin taking high-dose supplements and then notice unusual sensations, such as a fluttering heartbeat. The iron overload factor. Another important piece of the puzzle is vitamin C's relationship with iron. Vitamin C significantly increases the absorption of iron from food. For most people, that's beneficial. But for some individuals, it can create problems. One example is hemochromatosis, a genetic condition that causes the body to absorb and store too much iron. When people with this condition take high doses of vitamin C, iron absorption may increase even further, potentially leading to iron overload. Excess iron can accumulate in organs, including the heart. Over time, this may place stress on the heart muscle and potentially contribute to palpitations or abnormal heart rhythms. While vitamin C is best known for causing digestive side effects, such as diarrhea, when intake exceeds 2,000 milligrams per day, some reports suggest that excessive vitamin C may also act as a trigger for heart palpitations in sensitive individuals. Chronic intake far above recommended levels may contribute to nervous system excitability and cardiovascular disturbances that can manifest as palpitations. Understanding this possibility helps explain why even beneficial nutrients can become problematic when consumed in excessive amounts. How much vitamin C is actually too much? Supplement labels can be confusing, but two numbers are particularly important when evaluating vitamin C intake: the recommended dietary allowance, or RDA, and the tolerable upper intake level, known as the UL. The RDA represents the amount needed to meet basic nutritional requirements. For adult men, the RDA is 90 milligrams per day. For adult women, it's 75 milligrams per day. The UL represents the maximum daily amount considered safe before the risk of side effects begins to increase. For adults, the UL for vitamin C is 2,000 milligrams, or 2 grams, per day from all sources, including both food and supplements. Once intake regularly exceeds 2,000 milligrams per day, side effects become more likely. These can include digestive upset and, in some individuals, concerns about heart palpitations. putting vitamin C doses into perspective. The numbers become easier to understand when viewed in real-world terms. Many people can meet their daily vitamin C needs through food alone. A medium orange contains roughly 70 milligrams of vitamin C, while a cup of chopped red bell pepper provides approximately 190 milligrams. Supplements, however, can deliver highly concentrated doses. It's surprisingly easy to exceed the 2,000 milligram upper limit if you're taking multiple products. Many immune support supplements contain 1,000 milligrams of vitamin C in a single serving. Taking 2 servings per day, along with vitamin C from food and fortified products, can quickly push intake beyond the established safety limit. It's also easy to underestimate total intake. Someone may take a vitamin C powder in the morning, chew vitamin C gummies later in the day, and consume fortified beverages without realizing how much vitamin C is accumulating. Understanding these numbers can help put supplement doses into perspective. A 1,000 milligram supplement provides more than 10 times the amount required for basic nutritional needs. While short-term high doses may be tolerated by some people, regularly exceeding the 2,000 milligram upper limit is not recommended and increases the likelihood of side effects. Are you more sensitive to vitamin C side effects? Just as some people can drink multiple cups of coffee without issue while others become jittery after a single serving, people can respond very differently to supplements. Your health history, body chemistry, and genetics can all influence how you respond to high-dose vitamin C. If you've ever wondered why a supplement affects you differently than someone else, the answer may lie in your unique biology. Underlying health conditions matter. Certain health conditions can change how your body processes high levels of vitamins. Kidneys play a critical role in eliminating excess water-soluble vitamins, including vitamin C. If kidney function is impaired, high doses may be harder to clear from the body, potentially increasing the risk of side effects. People with existing heart rhythm disorders may also be more sensitive to changes in their body's internal balance. This includes the potential cellular stress associated with very high vitamin C intake. Being aware of these factors can help you make more informed decisions about supplementation. The critical link between vitamin C and iron. One of the most important and frequently overlooked aspects of vitamin C supplementation is its effect on iron absorption. Vitamin C enhances iron absorption, particularly from plant-based foods. For most people, that's helpful. For individuals with hemochromatosis, however, it can be dangerous. Hemochromatosis is a genetic disorder that causes excessive iron absorption and storage. It's estimated to affect about 1 in 300 people of Northern European descent. When someone with hemochromatosis takes high-dose vitamin C, iron absorption may increase substantially. This can lead to iron overload, which can be particularly harmful to the heart. Iron deposits within the heart muscle may contribute to tissue damage, arrhythmias, and heart palpitations. Because of this risk, people with known hemochromatosis are typically advised to use vitamin C supplements cautiously. Vitamin C can also interact with certain medications, including some chemotherapy drugs, statins, and blood thinners. Anyone taking prescription medications should discuss high-dose supplementation with a healthcare professional before starting it. Your action plan for tackling heart concerns. If you've noticed palpitations and suspect vitamin C may be involved, there are practical steps you can take. One of the simplest approaches is to reduce your vitamin C intake or temporarily stop high-dose supplements for a week or two. Observing whether symptoms improve can provide useful clues about a possible connection. Start a simple symptom journal. Keeping a daily log can help identify patterns that might otherwise be missed. Record the supplements you take, including exact doses. Note any symptoms you experience, including what the palpitations felt like when they occurred and how long they lasted. Also, record the time you took supplements and when symptoms appeared. This information can transform vague observations into useful data that you can share with a healthcare provider. While many palpitations are harmless, some symptoms require immediate medical attention. Seek urgent care if palpitations occur alongside dizziness, chest pain, fainting, or severe shortness of breath. How to have a more productive doctor's visit. Discussing symptoms with a healthcare provider can be much easier when you've documented what you've experienced. Bringing a symptom journal allows you to provide specific details rather than relying on memory. Instead of saying you occasionally feel unwell, you can show clear patterns and timelines that may help guide evaluation and treatment decisions. Careful tracking and a proactive approach can help you and your healthcare provider better understand what's causing your symptoms and determine whether vitamin C is playing a role. Frequently asked questions about vitamin C and heart health. What are the first signs of taking too much vitamin C? Digestive symptoms are usually the earliest warning signs. When intake exceeds about 2,000 milligrams per day, common symptoms include diarrhea, nausea, stomach cramps, bloating, and gas. These symptoms occur because the body can only absorb a limited amount of vitamin C and must eliminate the excess. Can vitamin C cause anxiety or jitters that feel like palpitations? For some people, yes. Vitamin C does not directly cause anxiety, but the physical effects of very high doses can sometimes create sensations that feel similar to anxiety or palpitations. Digestive discomfort or other physical reactions may leave someone feeling jittery or unsettled. In some cases, this can create a cycle where unusual sensations trigger anxiety, and anxiety then contributes to actual palpitations. This highlights the close relationship between the nervous system, the digestive system, and the heart. When should you talk to a doctor? It's a good idea to speak with a healthcare provider if you've reduced your vitamin C intake but palpitations continue, if palpitations occur alongside symptoms such as dizziness, chest pain, or shortness of breath, or if you already have a known heart rhythm disorder, kidney disease, or another medical condition that could increase your risk. Listening to your body's signals and seeking medical guidance when symptoms persist is always a sensible approach.